Hi everyone, I'm Dr. Roman Hunter, and today we're going to be talking about manual muscle testing, otherwise known as MMT. Now, MMT has 6 grades, from grades 5 to 0. Grade 5, otherwise known as normal, is when the person is able to complete full range, or in other words, throughout the available range of motion, and is able to hold against maximal resistance. The muscle is able to hold against maximal resistance. For grade 4, otherwise known as good, is when the person is able to complete the full range or the available range of motion and is able to hold against moderate resistance. So if you were to apply maximal resistance and the person breaks, that would be a grade 4, right? So it's just moderate resistance. For grade 3, otherwise known as poor, or fear rather, my apologies, is when the person is able to complete full range without manual resistance. So they're able to complete full range or go through the available range or go to any range just against gravity, in a gravity maximized position, all right? For grade 2, otherwise known as poor, is when the person is able to complete partial range. They're unable to complete the full range, just partial range, or you put them in a gravity minimized position and you're able to perform the full range in a gravity minimized position. All right? For grade 1, otherwise known as trace, is when the person just has a palpable contraction or a visible contraction. And for grade 0 is when there is no visible nor palpable contraction occurring in the muscle. And 0 is otherwise known as, you guessed it, 0. Alright, so when performing MMT, you want to make sure that the body part is exposed. You don't want to have it fully clothed or you have bulky clothing over the area that will limit the range of motion and you won't be able to see any visible muscle contraction occurring. So you want to make sure that the area is exposed and you drape them accordingly. Alright, now in terms of, just before we go, I just want to also mention that for some joints there may be some arthritic changes that will affect the range. So the person may not be able to perform full normal range of motion just because of arthritic changes occurring within the joint itself. May also be due to capsular issues or some internal derangements occurring in the joint. So you allow the person to take the limb through the available range that they have within their capacity, through the available range, or you take them to the end of their range. They're able to take themselves to the end of their range. And you perform the test within their available range that they have. Alright, so this is MMT, manual muscle testing, that we'll be talking about. Thank you very much. My name is Dr. Roman Hunter, and today we're going to be doing MMT, that's manual muscle testing for hip extension. Alright, now the primary movers for hip extension are the hamstring group of muscles, that's the semitendinosus, semimembranosus, and the biceps femoris, as well as the gluteus maximus. Alright, so let's begin. Alright, great. So here we have the patient in prone line, alright, because we're doing hip extension, so the starting position for the patient is in prone line. Alright, the starting position for the examiner is to the same side as the testing limb. Okay, the same side as the testing limb. Now, the hand, you're going to have a stabilizing hand and a hand that's performing the test. The stabilizing hand will stabilize the pelvis. Alright? Stabilizing hand stabilizes the pelvis to maintain the alignment of the pelvis and the rest of the body so that when the person performs the hip extension, there is no abnormal shifts or exaggerated shifts or turns or twists of the body. Okay? Now, the testing limb can either be applied distal leg or it can be applied distal thigh. Distal leg or distal thigh, depending on the situation. If it is that the person is very strong, you may want to do it distal leg. Otherwise, from that, you do it distal thigh. So the instruction that will be given is go ahead and lift this leg up towards the ceiling for me. Go ahead and lift while it's stabilizing. So this hand is stabilizing the pelvis. Sometimes the person will tend to go ahead and hyperextend. That is what you don't want. All right, go ahead and put it back down. All right, good. Keep it right here. So I'm stabilizing the pelvis, and I'm going to apply pressure. Keep it there, don't let me push it down, keep it there, keep it there, keep it there, and continue to keep it down. She's extra strong, let's say she's extra strong, keep it there, and you apply the pressure distal leg, right? So you can start here, and then you move down to distal leg, okay? Now, you can go ahead and lower it down. If it is So she had just completed her full range in hip extension, so that would be a grade 3. If it is that she breaks under maximal pressure or resistance, then that would be a grade 4. If it is that she holds under moderate resistance, that would still be a grade 4. All right? Now, I'm going to go ahead and show you grades 2 to 0.
Go.
All right, great. So we're looking at MMT. This is for grades 2 to 0. All right, let's say that the person is unable to accomplish a grade 3. Grade 3 lifting just throughout the range. And you want to also bear in mind that if there is any other situation going on with regards to the hip, they do it within their available range. They perform the movements, they perform the range within their available range, within their capacity. Okay? Now, we have the person in sideline for grade 2. This is the starting position for grade 2. She's in sideline. We want to bend the bottom knee to help with balance and support for her. And the stabilizing hand for the therapist will still be at the level of the hips or the pelvis. Okay, stabilizing hand will still be on the pelvis right there, and the hand that won't be performing. There won't be performing any resistance with the testing hand. However, what will happen is that we'll cradle the leg. So the hand that will be performing the test is the hand that will be cradling the leg, while the stabilizing hand will be by the pelvis. So you want to cradle the leg like this, and then you're going to go ahead and bring your leg back from it. Just go ahead and bring it back, and she's able to complete the movement. Okay, all you're doing is cradling the hand. You're not helping her or assisting her in terms of pulling it back. She is performing the movement. You're just accommodating, right? You're helping her to move the limb through that range there. So you're putting her in a gravity minimized position, and she is performing the movement while the hand is cradling the leg, and the other hand, the stabilizing hand, is stabilizing the pelvis. So there's no excessive extension of the pelvis and of the lower back, or no turning and shifting of the body. Okay, so this will be a grade 2 for MMT, hip extension. All right. All right, good. So now we're back in prone line, and this will be for grades 1 to 0. MMT grade 1 to 0 for hip extension. Okay. Now the person is unable to accomplish or perform any movement whatsoever, right? So we say, okay, fine. We'll put them back in prone line position, and what we're going to be just doing is just palpating. We won't be stabilizing anything. I won't be supporting any limb or anything like that, like what we did in the other test. We're just going to be watching and palpating, just observing, okay? So the instruction I'm going to give is go ahead and try and lift this leg for me. And what you'll be palpating is the gluteus maximus muscle right here, okay? This muscle right here, the gluteus maximus, you're palpating that. And what you're palpating for is muscle activity. You're trying to feel for that contraction, and you can also see the visible contraction occurring right there. Relax. And go again. I can see the visible contraction of the gluteus maximus. And that way you'll know that that will be a grade 1. So she's unable to accomplish any movement of the limb, but you can see the visible contraction. You can see it, and you can also palpate for it, and you know then that will be a grade 1. Grade 0, of course, is there is no visible contraction, and there is no palpable contraction of the muscle. Okay, so that will be a grade 0. So this is MMT, manual muscle testing for hip extension. Thank you.